Hello, so today we're going to be inserting and removing a male Foley catheter. So first you'll go ahead and check in the chart, make sure there is an order for an insertion of a Foley catheter. Then I would go ahead and perform hand hygiene and identifying my patient. I would go ahead and check the ID band, also verifying the name and date of birth. All right. I would pull the curtain closed for privacy and then proceed to explain to my patient what we're doing. Mr. Smith, we're going to be inserting a Foley catheter. Okay, you will feel a little discomfort. All right. Then I would go ahead and gather all my supplies here on the side. I would go ahead and put on some gloves and bring my patient up to the appropriate height, which is at elbow level. You would then go ahead and uncover your patient. We're going to uncover you. All right. And then go here. You do want to spread your patient's legs just for extra space there, if possible. So first, you want to go ahead and drape the patient. All right. And then you will provide perinatal care. Making sure your patient checks the water temperature before you do clean them up, and it is appropriate and comfortable. So you would go ahead and grab your washcloth and put it on as a mitt. Right? Or the appropriate cleansing solution. You want to grab here, wash around the tip here, putting back on your foreskin. Rinse, flip the towel here, and then go ahead and clean from the top down. Rinse, wash, down, 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 and down. Okay, we do want to go ahead and rinse. Same motions around the tip first. Rinse, down, 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 and down. Okay. Then you want to go ahead and dry your patient, pat drying. And go ahead and remove your gloves and perform hand hygiene once again. All right. Then you want to go ahead and set up your sterile field. I'm going to go ahead and place this on the side of my patient's bed just for a closer discard of supplies. Open here. I have my gloves here. Cup end towards you. I am going to go ahead and open my sterile place here on the patient's bed. All right. Mine only has 2 folds, so I would go ahead and open here. They are in the wrong way, so I am going to turn my gloves. In any other case, I would throw these gloves out and start over again. So once I do take my gloves out, I'm going to open them here. Cuff end towards me. Open. pinching the cuff, my non-dominant hand placing on my dominant hand, and then going under the cuff here and putting it on. Discarding of this. Alright, now that my sterile gloves are on, I am going to open up my tray. Shiny side out. Making sure you don't touch your patient. We're going to place the first drape. Opening up your second drape. Shiny side out again. This is to extend my sterile field. Alright, now I'm going to move my sterile field. Right, I do not need the first drape, so I'm going to toss that. I would ask my patient if they have any allergies. He does not. So I can use either the iodine or the hydrogen peroxide. In this case, I'm going to use the hydrogen peroxide, so I'm going to toss the iodine. I'm going to open the hydrogen peroxide and place my solution on the cotton balls there. Tossing that. Opening my lubricant. Putting that down there. Tossing that. I'm going to go ahead and open up my syringe and connect it to my catheter here. Right. Okay. I don't need this at the moment, so I'm going to put that on the side. I'm going to open up my catheter, toss this, and putting this into my lubricant. Okay. And then I will go ahead and once my non-dominant hand touches my patient, I can no longer use it until after the procedure, after the insertion is done. So I'm going to go ahead and use the forceps, fluff my cotton balls, grab the penis, pulling any skin back, cleaning the tip first, tossing that, grabbing another cotton ball, cleaning from the tip down shaft, toss, down the shaft, toss, down the shaft, toss, and then also down the shaft and toss, and also discard of my forceps. Now I'm going to go ahead and insert my catheter. I'm going to tell my patient to take a deep breath. All right, ready? 1, 2, and 3. I'm going to insert. All right, once you do see urine, you go ahead and pushing until you get to the Y here, the split. All right. And then you will go ahead and inflate your balloon. Once you've done that, you remove your syringe, place that on the side, and then just gently tug for placement. It is secure. You would go ahead, if there is a stat lock in place or a leg band, you would go ahead and place that on the patient with the appropriate slack. You would place that there and then hang the bag down on the bed, not on any of the rails, just to prevent any pulling. All right. Then you would go ahead and discard any equipment here. You would toss this in the trash. Okay, and then perform any perineal care just to remove any excess gel or liquids that are on the patient. Okay, you would wash, rinse, and pat dry. You would discard of the drape here. Cover your patient up. If there were any specimens that needed to be collected, you would collect those. Lower the patient down to the appropriate height. Remove your gloves. And then perform hand hygiene. And now we're going to remove the Foley catheter. So again, you would check the patient's chart, making sure that you do have an order to remove the catheter. You would perform hand hygiene, identifying and verifying your patient on their wristband, verifying their name and date of birth. I'm asking if they you would go ahead and close the curtain to provide privacy and let the patient know what you're doing and why. So, Mr. Smith, we are going to be removing your Foley catheter. There may be a little discomfort, okay? So then you would raise the bed to the appropriate height, which we did leave that in this position. Then you would go ahead and put on gloves. Alright. Alright, you would put a pad down on the floor. You would go ahead and drain the catheter, documenting the amount, color, odor, and then putting that in the chart. You go ahead and pull this down here. Right. Clean that up. You would go ahead and put a pad underneath the patient. Perfect. We'll go ahead and remove the leg strap or the stat lock here that you have. Putting the bag on the bed. Alright. You would tell your patient or you would grab your syringe. Hook it up here. And then you should start seeing the same amount of fluid that you put into the balloon go ahead and retract itself slowly. It should be about 10 mils. Alright, now that you do see that same amount in the syringe, you would go ahead and remove that. And then you would have your patient take a deep breath. Alright, Mr. Smith, take a deep breath for me. Blow out, blow out, blow out. Perfect. Fold that up in the pad, toss that, and then you would go ahead and provide perineal care around the same technique, the tip, down, 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 rinse, pat dry, cover your patient up. Alright, and then going ahead and lowering them back to the appropriate position, making sure they are comfortable. Removing your gloves and performing hand hygiene.